call the meeting to order. Start with the Pledge of Allegiance. Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. We'll start with the approval of the April 10th, 2024 Health and Human Services Committee meeting minutes. Motion by Supervisor Cavelli, second by Supervisor Conway. All in favor? Aye. Any opposed? Motion carried. Thank you. 5, policy issues discussion and potential committee determination. None. Before we get to 6, I'd like to just we'll do some brief introductions because it's a new board, so we typically do this in the first meeting. So I'll start with myself, being the chair. I've been on the county board for 6 terms. I served 5 terms as your NACO delegate, National Counties Association. I was the Health and Human Services chair for 2 terms. Then I was public safety chair for 2 terms. So that's what my role has been on the county board thus far. So with that, I'll move on to the vice chair, Jennifer.
My name is Jennifer Arstad. I've been on, this is my 2nd term. I was appointed back in 2021. And I've been on Health and Human Services. This is my 2nd term on this. And vice chair. Thank you.
Moving on, Ron Cavelli.
All right, you already know my name. Ron Cavelli, 2nd term on the board, 2nd term on the Health and Human Services Committee. I really enjoy this committee, a lot of good conversation and actions. I also serve on the board of directors for McDevco as a county representative, and that's who I am.
Supervisor Conway.
Thank you. My 2nd term too, although non-contiguous. So I was on ERC the first time, and however, I run Northern Valley Industries, so we have kind of a big footprint with Health and Human Services. So probably why I'm here.
And then Supervisor, is it Foot or
Chantel Foot.
Foot,
Yes,
okay,
It
perfect.
is just plain Foot. I don't know why there's an E. This is my first time on the board, and I'm just here to learn what I need to do and help out however I can.
All right, Supervisor Radke.
Yeah, my first term, Randy Radke, first term, and just here to pretty much first learn a lot. So that's all I have to say.
Perfect. And then I have Yiling Zhang on WebEx.
Hello, everyone. This is Yiling Zhang. I'm a County Board Supervisor representing District 19. This is my first time on the Health and Human Services, but it's my 5th term as a County Board Supervisor.
All right, thank you, everyone. We'll move on then to 6, operational functions required by statute, ordinance, resolution, or policy. And we'll start with A, resolution to amend the 2024 budget to accept $3,000 in grant funds for rental assistance.
So, I don't know, Krista, you want to come up or you want to talk right there? Up to you. All right. Well, just to set a little context for you as to why you have a resolution in your packet to accept $3,000 of grant funds from United Way. State law, as set forth in the resolution, requires that any time the county is going to be receiving and expending more money than what was allocated in your annual budget, we bring to you a budget resolution, a budget amendment resolution. Sometimes those are significant resolutions for significant changes in the budget, like if we have an issue within one of our departments or one of our buildings that requires us to move money to spend for. A number of years ago, we had a large water heater complex within the courthouse go out. That was a couple $100,000. That's on one end. And then we have things like $3,000 from $3,000 of grant funds, which is significant, and it's for a very good purpose. But it is kind of on that smaller end of the budget amendments. But it's still nevertheless necessary for us to do based on state statute. So Krista, can you just walk us through what the budget amendment is for specifically and kind of talk a little bit about the Elevate program and how that's been working?
Absolutely. So my name is Krista Jensen. I'm the Director of Marathon County Social Services. I've been in that role a little bit over a year now. As Administrator mentioned, we are bringing to you actually two amendments today in resolutions. The first one being $3,000 that we received from the United Way towards our Child Support Elevate program. Child support is typically known as the place where individuals pay to the other parent. And our program has something really unique that we help to ensure that parents are able to pay and that they're engaged in their child's life outside of just submitting those payments. So Elevate will do things to help ensure that individuals are able to make those payments, helps them to get job, helps them with transportation, clothing that they might need. They've done things like life skills coaching and things of that nature, supervised visits, parent education. And so this grant was received to help specifically with housing. So individuals who are enrolled in our Elevate and our Children's First program. Children's First is for individuals who have drug convictions, and so helping them to get back on their feet and able to be engaged in parenting in their children's lives. So this $3,000 is specifically to that Elevate program for individuals who are enrolled in those programs to help them with housing supports. That's $3,000 put forward from United Way for that program.
Any questions?
So from a process standpoint, if you were to make a motion to recommend approval of this budget transfer, your rules have these issues also taken to the Human Resources, Finance, and Property Committee, but any budget amendment does also need to go to the full board. So there's a bit of a process for each of these. You'll see this a number of times throughout the year, and we'll do it for the next item as well. But what would be in order for you if you agree with the acceptance of the grant funds for purposes of continuing this program and expanding the housing services? You would offer a motion to recommend acceptance of the grant funds to the Human Resources, Finance, and Property Committee and the full board.
I'd like to make a
So moved.
motion to accept the $3,000 grant funds from the United Way.
Motion made and second. Any further discussion? All in favor? Oh, go ahead, Ron.
Sorry. Just one question. How many people or families are in the Elevate or Children First program?
That's a great question. I think at the last presentation I was able to provide those numbers, and I don't remember what they are off the top of my head. I want to say Elevate is serving somewhere around 20 individuals at this point in time. I don't know off the top of my head around Children's First grant.
Okay, thank you.
Further questions? All right, all in favor signify by saying aye. Aye.
Aye.
Any opposed? Motion carries unanimously. That will move on to 6B, resolution to amend the 2024 budget to accept $20,000 in grant funding for the Family Keys program. With that, we'll turn that over again.
Yep, same introduction. Krista, you want to tell them what Family Keys is?
Sure. So Family Keys is a program. Marathon County is one of 3 counties in the state that was selected by the Department of Children and Families to participate in this. And they supplied funding to support families where housing instability was the primary reason children were either being removed from their parental homes or that they were not able to be reunified with their parental homes. So all other safety concerns had been mitigated, but housing was the only need that was holding them up from either needing to be placed or not being able to be reunified. We provided a presentation a few months ago talking about our year 1 outcomes for Family Keys. We saw significant outcomes, I think really blew my expectations out of the water. We saved over $300,000 in out-of-home care money by utilizing our Family Keys program. And so we've really been working on how to make sure that this Family Keys program is sustainable. And we would like to be able to do that without using all of our taxpayer dollars, right? And so as I shared, we've been able to reduce our out-of-home care monies and where we probably could put those monies, if your approval, towards the Family Keys program, but we want to make it sustainable within our community. We really feel like this is a program our community needs to be invested in. Providing families with housing and the supports that they need to be functional family units impacts their ability to be productive members of our community and our society. And so we're really trying to engage our community in holding up this program. And so we have been applying for quite a number of grants, and we received a grant from GreenHack for $20,000 to support the Family Keys program. And so that would reduce the amount of tax levy that we ever needed to put into this program. It reduces the amount of funding that we have to ask for from the state in order to make this sustainable. And this program is currently serving, I think we have somewhere around 16 families currently engaged in our Family Keys program. And we were able to prevent the removal of 39 children in 2023 because of the Family Keys program. So really, it provides for case management. They're seen once a week by a case management provider working on budgeting. They're required to save 30% of their income when they're in this program so that they can be sustainable going forward. And the Family Keys program is intended to be between 4 and 9 months of engagement that we are paying for their rent. We're helping to secure them housing, and the hope is that they're able to stay in that same home that we've been able to put them into, develop relationships with landlords. Many of these individuals have prior evictions or drug histories that prevent landlords from renting to them, resulting in their children needing to be placed in out of home or only being able to rent homes that are really unsafe. And so we're able to help them stay here in our community, stay together, save some money so that they can be sustainable going forward, and help to really identify what those barriers were that led to our involvement in the first place to keep their units together.
Questions? If not, I will entertain a motion. Motion made, or you wanted to make a motion?
I will make a motion. I will make a motion to accept the $20,000 grant funding for the Family Keys program from the Green Heck Foundation.
Motion on the floor. Do I have a second? Second. Any further questions, comments? All in favor signify by saying aye. Aye.
Aye.
Any opposed? Motion carries unanimously. Thank you.
Thank you.
All right, with that, we will move on to 7, educational presentations and committee discussion. Review of standing committee related ordinance under section 2.04, including mission, duties, and responsibilities and jurisdiction. With that, I will turn it over to Mr. Leonard.
Thank you, Chair Boots, and please, this is meant to be, well, first and foremost, informative, but also I don't want to be the one just talking the whole time. So hopefully if you have questions or certainly if any members have comments, please feel free to offer them. Just wanted to take a little bit of time, like Chair Boots referenced when you started the meeting with introductions, just to ground everyone in the standing committee ordinances that apply to each of the standing committees. So in section 2.04, each of your standing committees are laid out in that it's a similar fashion for each of them. And for you, of course, you are the Health and Human Services Committee. So under subsection 5, we talk about the mission and purpose. And the language here is always quite similar. But to provide leadership for the implementation of the strategic plan, monitoring outcomes, reviewing and recommending to the board policies related to health and human services initiatives in the county. You also have some statutory obligations and responsibilities that are laid out there. And again, those really do relate to health and human services work. Your term, of course, you are county board supervisors. There's not any citizen members on this committee. There's one standing committee that does have a broader representation, membership, and that's your Environmental Resources Committee. But really, you are the policy body. That's why you're made up entirely of elected officials. If you look through the rest of your rules beyond standing committees and get to those program committees that we'll talk a little bit about in a minute, you'll see that the membership often is very, very different. So let's talk a little bit about that reporting relationship. Primarily, what you're going to see throughout your term is that your reporting relationship is really an oversight relationship relative to county departments and then also some other entities, and you're going to hear a bit from each of those today, but your Veterans Services Department, Social Services, and Health Department, and we'll go through and kind of provide you a real quick overview from each of those departments as we move forward. But I wanted to, before we get into the introductions to those departments, bounce over here. I also wanted to talk a little bit about your role relative to the strategic plan. So you might well be asking, based on that rule, well, what strategic plan priorities do we have? And I pulled up the county website, and I know we went through this during orientation as well, but the strategic plan is available on the website. If you go down and click on the strategic plan, I'll open the most up-to-date document, the 2023 and 2024 strategic plan revision. And as you go through that document, you'll see that there are a number of objectives. And again, you are the Health and Human Services Committee, so we'll start with that area to talk about what obligations, what role do you have with regard to some of these objectives. And specifically, this committee actually serves as the primary committee with respect to Objective 3.3, which is ensure that every person makes it to adulthood with health, stability, and growth opportunities. In that effort, you're supported by the Public Safety Committee, but the hope is over the term, and we'll talk more about this later, that your discussions should be aimed at accomplishing that objective, and we'll talk more about the strategies later. Then also, Objective 3.7, you are the lead committee of jurisdiction, and that is ensure that every person has local access to effective mental health treatment. Also with respect to, so that's the healthiest section. So you have those two as your lead. And then I'll go down before we go back up. But then in the safest section, Objective 7.2, you're also identified as the lead committee. You're supported by Public Safety again, but that Objective 7.2 is mitigate the impacts of drug and alcohol abuse in Marathon County through evidence-based practices. So as you look through this strategic plan document, and I'm not going to go through it in detail really any more than I've already gone through, other than to say that your discussions, as I alluded to before, throughout the term, those are your that each of those objectives for which you are serving as the lead committee. The hope is that you can use this document and the strategies and outcome measures laid out in it to help you develop those policies and recommendations for staff, primarily myself, then to work with the individual departments to carry out. So you'll see in this document kind of that green bar across the middle. That is Objective 3.3 I referenced before, just to orient you to how this document then is laid out. The strategies that, again, were developed through your strategic plan are laid out across the top. Strategies A through F. Now, you might ask, where did those strategies come from? And the short answer is the vast majority were drawn from your comprehensive plan. There are some in some of these objectives that are new beyond the comprehensive plan. But again, those are the strategies, kind of the levers we hope to pull to accomplish that end objective of ensuring that every person makes it to adulthood with health, stability, and growth opportunities. The outcome measures along the bottom there, where you see outcome measures 1, 2, and 3, those are the things we would expect to see if every individual in Marathon County was able to make it to adulthood with health, stability, and growth opportunities. So again, how would you know you were moving in the right direction? Just as an example, outcome measure number 1 says, well, we would see essentially an increase in graduation rates. That makes logical sense, right? If we were ensuring that everyone made it to adulthood with health, stability, and growth opportunities, one of those outcomes we would anticipate seeing, we know there's a strong correlation between high school graduation and positive adult outcomes. That is one of those things we would expect to see. Not that Marathon County has a whole lot of direct control over high school graduation rates. We certainly have some. Through our social services work, we do actually work with kids who are youth that are being held and they're getting schooling through our secure detention, or they're working with our child protection unit. We are working with a small population of children, but how, in the larger Marathon County context, can we increase graduation rates is kind of that broader question. Another example, again, with the outcome measures, we would expect to see a decrease in the out-of-home care placement days that are experienced in Marathon County by youth. As Krista alluded to with the Family Keys project, that was started a number of years ago. And Vicki was actually up here talking about it in her previous role. We know that there's a correlation, a negative one, between being placed out of home and positive adult outcomes. We do it when we need to mitigate safety concerns that Krista alluded to, but we know that we have far better outcomes when we address those safety concerns and those issues and still are able to keep children safely in the home of their parents. That's better. So we would see that reduction in those out-of-home care days. So that's how the document is organized. And then you'll see in the bottom right corner, those are the departments that, when we put the strategic plan together, that we contemplated playing a role. Not saying that the ones, it's not listed in anything other than alphabetical order. Certainly the clerk of court's office or even county administration, we're not the second most important department with respect to accomplishing those goals, but those are the ones that we think, hey, they logically have a role to play. So that's how that document is laid out throughout the strategic plan. So going back then to your duties and responsibilities under the ordinance, under 2.04 sub 5, really you'll see first and foremost, as the policy body, you're there to foster the implementation of that strategic plan. I won't go through those things in detail. I already alluded to the specific county departments that you'll hear from a lot. That's the Veteran Service Department, Social Services, and Health. But there are other relationships you have that are important as well. You have program committees I referenced before, the Social Services Board. You will see oftentimes that social services discussions start at that program committee and then funnel up to this committee and ultimately to the board. Similarly, we have a Veteran Service Commission. Their role is somewhat different, but you may hear from them from time to time. You also have the Transportation Coordinating Committee that the thing they deal with most often that you'll see that is highlighted annually is our 8521 grant program. And that is 8521 is this specific statutory section, 85.21, but it facilitates transportation for individuals for allowable reasons that are elderly or disabled. It arranges rides for them. So you'll hear from those program committees. That said, you also have some other organizational relationships. You'll hear from the Marathon County Board of Health. You'll see frequently individuals from the ADRC, and you have Mike today from the Aging and Disability Resource Center of Central Wisconsin, affectionately referred to with a long acronym of ADRCCW. You'll hear often from North Central Healthcare, and we'll orient you more to that moving forward. But you have Vicki and Gary here from North Central Healthcare today. They're, I could argue they should be listed more under the county department side because they are essentially a county department of multiple counties. But you'll hear from the North Central Healthcare Board or the executive committee from the board from time to time as well. And then also, to a lesser extent, each of those other entities listed there. So that's always a good place in my mind. It's my old lawyer training. When in doubt about how things should be organized, I like to look to the statutes or the ordinances, and your ordinances lay out how you're set up, how you're organized. And for you, this committee, it's 2.05 sub 4. So with that, Mr. Chair, I think I've belabored the point of your ordinance for your mission, duties, and jurisdiction. If anyone has any questions, I'd be happy to take them. Otherwise, we can jump right into meeting the people that you're going to hear for that are experts in their individual areas. But I don't want to gloss over if there are questions. Silence is golden. So with that, we'll kick it off with the health department, and Laura Scudari, our health officer, can start that conversation. I'm going to pull up another good document that I think always serves as a good place to start with respect to if you have a question about what a department does or how they're organized. The county budget is a great place to start. So I'm going to pull that up, and we're going to start with the health department. But within our annual budget, I talked about it during orientation, it's the largest single policy document you have each year. So we're going to go through what are the county departments and other organizations that you fund through the budget that this committee will frequently hear from. So Laura, you want to take it away and talk about what it is that the health department does and how you're set up? And
Sure,
if you wanna
thank you.
Tell me when to scroll to the next line.
Okay. All right. I promised I wouldn't go through our entire annual report with you. My name is Laura Scuderi. When I explain how to pronounce my last name, I usually tell people it's Scud like the missile and dairy like the farm. So now you all remember that it's Scuderi from now on. I am the health officer with the health department. I've been with the health department since 2020, and I've been the health officer since 2021. The Marathon County Health Department is a level 3 health department, which is the highest level that can be obtained by the state, and that's specifically State Statute 251. Many of our activities are required by the county strategic plan and by our community's community health improvement plan, which are required activities by the state. And it's State Statute 25105. Other activities are required or regulated by the Department of Health Services for us. We do 4 primary activities: environmental health programming, we do communicable disease control, health strategy and coalition work, and family health work. Each of these activities is fully outlined in our annual report, which was hot off the presses. This is the 2023 report. We are required by the state to do this in 25106. This will be available on Marathon County's website, and we always publish our annual report on the website. So you can go back years and years and find annual reports from the health department there. I'd like to take a minute or two to review a little bit of our programming so you have a better understanding of what it is we actually do. Our community health improvement team houses many of our prevention activities. We have 6 staff members who are certified health education specialists who lead discussions and really provide a service as a health strategist within our community. And they lead discussions around mental health, substance use, housing, falls prevention, and nicotine and alcohol prevention, just to name a few. Their work and their contributions in 2023 are highlighted on page 12 and 15 of the annual report that I passed out. The Community Health Improvement Team, we call them the CHI team, also assists with creating and managing our LIFE report, which is our community health assessment, and our community health improvement plan. We also call that the CHIP. Our current plan is conducted every 4 years and is a facilitated process that engages key stakeholders, including county board members, in determining the health needs of our community. This information then informs the Community Health Improvement Plan, and these are required activities by the state, and our current plan is on page 16 through 23 and is also on our website. Environmental health encompasses activities including licensing and inspection of restaurants. And I like to say, if you've eaten at a restaurant in Marathon County and you didn't get sick, high five a sanitarian, because that was, they did go out to that restaurant and make sure that it was clean and healthy. They do a lot of inspections. They do over 1,200 inspections in a year. They do inspections of pools, restaurants, and mobile home parks. We also have a water testing lab that tests for contaminants like bacteria and nitrates. And we work closely with CPZ on groundwater safety programming. In environmental health, we also have radon and mercury programs. And we do a lot of lead prevention and mitigation work in our community as well. And those activities are outlined on page 25 through 29 of the report. Our family health programming is both treatment and prevention programming at its core. We do work for children and youth with special health care needs. We offer a regional network of resources for families, and that program has recently changed its name. It's now known as CRC North, so we're getting used to the name change. We also have a new program called the Nurse Family Partnership, which is in its 2nd year now, which we adopted because we sunsetted Start Right, which was the previous program. The Board of Health recently had an opportunity to have a mother from the program come and speak to them about her experience in the program, and it was very moving. In this program, we pair a public health nurse with a prenatal family who meet certain income eligibility requirements. We then have that nurse meet with the family weekly to determine what needs that family has, and they continue to meet with the family up to age 2. This is a really well-researched and studied program, and we've already seen some really promising results in the families that we're following. Longitudinal studies of this program, the Nurse Family Partnership Program, have shown that it has a return on investment of over $60,000 per family served, or a 6.4 to 1 benefit to cost ratio. Nurse Family Partnership has had more than 40 evaluation studies, including randomized controlled trials and large-scale replication data. And according to the county health rankings, evidence rating, an NFP gets the highest rating, indicating strong scientific support, citing long-standing evidence. And they highlight the following outcomes. One is NFP mothers have more stable partner relationships, enhanced parenting skill, and are less reliant on welfare. The participants are less likely to deliver their babies preterm and are less likely to initiate and continue breastfeeding than non-visited mothers. Participants engage in fewer risky behaviors with less substance use and during pregnancy especially, and experience less impairment to parenting due to substance use. NFP also appears to reduce mortality in both mothers and children over the long term. So that's our maternal health programming. We also do communicable disease programming. It's pretty much what everybody knows us to do at this point. We do a lot more than communicable disease, but we also do communicable disease programming. We are statutorily required to follow up and mitigate Category 1 and Category 2 diseases, including TB, measles, anthrax, botulism, pertussis, just to name a few. There's a full list of all the different diseases that we follow and we mitigate on the DHS website. So this is a very, very quick, abbreviated review of our department because I promised I wouldn't read the annual report from start to finish. That gives you a quick overview of all the things that we do in a year. The annual report is a really great resource to, my watch wanted to talk. Annual report is a really great resource to get a sense of the things that we track. Also, we track a number of data. It's part of our reason to be is that we actually look and track different disease processes and community needs. So we do track our data. We have a dashboard in here that determines how well did we do, how much did we do, and whether or not anybody was better off because of the work we do. And we're very proud of that. So let me know if you have any questions.
They're all on mute. If anyone does have any questions, feel free to ask. Otherwise, next up, Krista, you wanna go?
Sure, I can take it away. All right, as I mentioned a little bit ago, my name is Krista Jensen. I'm with Marathon County Social Services, and we run quite a number of mandated programs. The first one that people typically think of when they think of social services happens to be Child Protective Services, so I can chat about that first. Under Child Protective Services, which is a mandated program by the Department of Children and Families, there's a few components. So the first piece is we call it access. So that's the point where calls come in from mandated reporters or concerned community members with allegations of child abuse and neglect. They then make the determination if that rises to the level the state has set for an assessment to be completed, and if it does, they determine a response time of when the social worker needs to make contact with the children and family. Once they determine that a report does rise to that level, the initial assessment team has 60 days to complete an assessment and determine if the family is in need of additional services, if those children are safe, if they can remain safely in the home with supports, if they can remain safely in the home without supports, or if we just need to really give resources out to the community and give some connection. If they determine that children are not able to remain in their home safely, or they're able to remain in their home with additional supports, we might still need what we call a CHIPS petition, a Child in Need of Protection and Services, and that's filed with Corporation Counsel's Office, so we work very closely with them. Then it moves on to our ongoing Child Protective Services team, and they work with the families then long-term to work on reunification. The first goal, anytime if we have to remove a child, is always to look at reunification as our first option. In the event that reunification is unable to happen for a variety of reasons, and they are looking at other permanency options for youth, which can be either a guardianship or an adoption through the termination of parental rights process. At Marathon County, under our Child Protective team, we also do have a foster care coordinator, and so we license foster homes in Marathon County. We have around 58 foster homes that are licensed in Marathon County currently, and so they will do emergency licenses. So if we have to place a child and they are getting placed with anybody who maybe they have a significant relationship with, but they're not a family member, we have to do an emergency license. That has to happen in 30 days. You can ask for one extension up to 60 days. Otherwise, if they are a relative and fall under that definition the state has set, they can receive court-ordered kinship care. They can become a licensed foster home if they wish to, but they do not have to. Really big win for the state of Wisconsin recently was expanding the definition of like kin. So that's going to be really huge for Marathon County and all counties really, to be able to place children with people who they know and who have a relationship with them without having to do a foster care license if they wouldn't wish to do so. So our Child Protective Services teams, again, really just work to do the least restrictive measure possible to keep children safe and provide families with the resources they need. The Family Keys program that we talked about a little bit ago falls under our Child Protective Services team as well, as we mentioned, to really make sure that housing instability or unsafe housing isn't a reason that our families have to be separated. We also have parent educators under our Child Protective Services team, so they can work with both birth families, foster families, relatives to ensure that they have the education and support that they need to parent the youth. Often our youth have been through a number of traumatic events and require some specialization in that parenting, and so we do have that available as well. We also provide supervised visitation in-house at Marathon County Social Services for parents and children who have been separated, as well as do in-house drug testing for those families. A lot of referrals happening to North Central Healthcare to support those families in meeting their mental health needs. We have our youth justice team, and that serves youth who have delinquent behaviors and sometimes truant behaviors. So typically referrals are coming from law enforcement due to needs that have been identified in the community, right? Laws that have been broken. And so youth who are a risk to themselves and to our community safety fall under our youth justice team, and we work to rehabilitate those youth so they can stay here in our community and they can be productive members and safe members of our community. We have been talking about our Youth Opportunity Center, and so that is under our Youth Justice team. That is opening June 4th, and that is a service model change to our traditional shelter program. Our traditional shelter program was really used as consequential placement. And it didn't have a lot of programming, food in the belly and a roof over your head, but not too much programming going along with it. That was previously ran by our Sheriff's Department, which closed down in 2021. So those funds were transferred to social services to run an alternative to that program. And so the Youth Opportunity Center, our staff actually just started on Monday, and they are really excited to get going, and we anticipate to have youth attending the Youth Opportunity Center who are mild and high risk on their youth assessment, their risk assessment, in order to prevent them from having to go into out-of-home placement. We can provide the services here in our community, the structure, the support, and they can return home every day, engage their families, and prevent them from having to go to placements. It also will support our group home and our foster homes. We often have youth who are not able to engage in a full day of school, and that can prevent foster homes from being able to provide a home to a youth because of their work schedule. And so this Youth Opportunity Center will support that as well, to be able to leave youth and lower level placements here in our community versus needing to be placed outside of our community and potentially even outside of our state. So we're excited for that program to move forward, and that falls under our Youth Justice team. Then we also provide children's long-term support services and comprehensive community support services. Marathon County Social Services holds the waiver for children's long-term support services. You'll often hear us reference that as CLTS. We use a lot of acronyms, so please just catch me if I grab one. And then North Central Healthcare is the contracted provider for the CCS, or Comprehensive Community Services. We are a service facilitator for that. However, they really run that program. And so both of those programs provide support to youth who have special needs, which could be cognitive delay, developmental disability, physical disabilities, all of those things to help keep them in their home with their caregivers, getting the support they need to be able to provide for their youth right in their home. We recently made an ask for additional positions to our children's long-term support team, so you may have heard about that, and we are in the process of getting them on board because there is a significant wait list for CLTS services. The state has asked there not to be a wait list for services for these youth, and our reality has been an inability to keep up with the number of referrals that are coming. We're getting anywhere from 10 to 15 referrals continuing every month on youth who qualify for the program. So we're excited to be able to expand and continue offering that. That's a fully funded federal program. Then we have our economic support team. So moving out of our child welfare realm, our economic support or income maintenance, it's also heard of, provides things that you might have heard of like food share, medical assistance, services for elderly, blind, and disabled. And so they have just a really wide variety of needs that they meet. They're primarily call center based, right? And so meeting families' needs over the phone. We also have a presence at the Community Partners campus where we can help folks access those services. There's a computer so they can get on and see what they have available, what's maybe waiting, as well as refer them to other services that might be beneficial for them in the community or at social services. We have our child support program. So I spoke a little bit about that with a $3,000 grant that you graciously moved forward. And so child support, as I mentioned previously, traditionally it sets orders for parents of what they pay, of what that visitation might look like, what that custody might look like. They do intergovernmental, interstate, and so if we have an individual who's ordered to pay here, we might work with another state, and then have the Elevate grant and the Children's First grant, which are fully funded by the state in order to help provide those services that individuals really need to be able to get on their feet so they can both fiscally support their youth and be actively engaged in their lives. So like I mentioned, most child support agencies are really just that payment source. In Marathon County, we have the ability to do those supervised visits, life skills coaching, help them get employment, transportation, housing if that's a barrier. And so they do a lot of things similar that you would expect a social worker to do, and we work really collaboratively together to make sure that those families that we are serving in conjunction with one another, that we're doing that in a really seamless manner. And then we have a lot of folks who are behind the scenes. So we have our administrative team, which we couldn't do any of our work without all of them, from our front desk staff who are greeting our customers who come in and directing them to the right services, to a general access line that helps direct folks to services, maybe at social services, but also outside and within the community, and really just help with there's a lot of paperwork involved in social work, and so they help with a lot of those different things. We have a finance team at social services. If you look through, you'll see a little bit of how our funding is made up, and I'm happy to talk and provide an additional presentation to this group if you'd like about how our funding is made up. We have a lot of grants, a lot of state and federal funding, and so really making sure that we're using all of that funding to our best ability and building our programs around the funding that we receive is what we do at Marathon County Social Services.
Questions? But
Thank you, Mr. Chair. Thank you, Krista. Are there plans to have an open house or tour of the Youth Opportunity Center?
So we have an open house coming up for social services on May 17th. We'll be doing a dedication for our Rise Up murals. And so then we'll also do, that's about a year that we've been at our new location. So we'll do a tour of that building. The Youth Opportunity Center, we don't have a specific date yet, but yes, we will. We're really in the process of deinstitutionalizing it at the moment, painting and replacing, metal doors and things like that. But yes, we will have that opportunity. Thank you.
Yeah, thank you. I'm excited to see, because I did see it before, and I'd like to see what the after looks like, and I'm excited to see that. Thank you.
anyone else? Who does? Go ahead, E.
Thank you, Mr. Chairman. I just want to commend Director Jensen as well, too. I know that we did talk a little bit about potentially even holding one of the social services board meeting there as well, too. So when that does happen, we will invite members of the Health and Human Services Committee to join us as well, too, just for that meeting and to tour that facility as well. So that's our commitment. Thank you.
Anything else? All right, I'll turn it back over to
All
Mr.
right.
Leonard.
And thank you, Mr. Chair. And I'll go turn it right away to Jill Jeffroy, who is our Veteran Service Officer, excuse me. And she can talk about her department, and that is on page 137 of the budget. Take it away, Jill.
All right, Jill Jeffroy, as he said, Veteran Service Officer for Marathon County. I've been in my position for about 4 years now. Prior to that, I was the adjutant at the Veterans Home at King. And all veteran service officers by state statute are required to be veterans. I was 22 years in the Army as an aeromedical evacuation pilot and officer. And we have 9,200 veterans in Marathon County. We have a staff of 3, actually 2.75. So we are very slim staff in comparison and ratio to veterans compared to other counties. But I happen to think that's because we're extremely efficient. We're paperless now. Since COVID, we had to find workarounds from all the filing and all the paperwork and 9 file cabinets. We scanned everything. We got a program to e-file and to electronically sign documents, so it makes it much easier for veterans. Some of the main things that we do is we provide burial benefits and military honors and markers for any veterans that pass away in Marathon County. We work with the families to get the military markers, the honors, and any burial benefits that they might need. And we average about 30 per month. We also do quite a bit of VA healthcare enrollment. We are very fortunate to have the Wausau CBOC, Community Outpatient Clinic, which is the old Shopco everyone refers to. We're very fortunate to have that here in Wausau. It is Toma Hospital is our catchment area, and they have 5 clinics, one being here in Wausau. That clinic not only provides general clinic support, they also have dental, they also have optometry, they have hearing, they have chiropractic, they have acupuncture, they have physical therapy, occupational therapy, they have a whole gamut of things. Anything they can't do there, they send veterans to the community. It's called a referral out to the community, and they'll be seen by providers that way. We do claims and benefits and appeals and pensions to help with service connection, disability claims, pension claims, survivor benefits. We have to stay up on a lot of federal laws and state benefits as well. So the federal law that just passed recently was the PACT Act, which is a significant legislation for our Gulf War era veterans. So we were extremely busy with that in August when that passed. We do state benefits as well, education benefits, other state benefits that veterans can receive through the state. So we are extremely busy. Last year, we do a monthly dashboard as well. Last year, we served over 3,600 veterans and their families. We secured $2 million for the county in pension and compensation claims, and that was up from 1.4 the year before. We do a number of outreaches. Last year, we did over 213 outreaches to the community, either presentations, either representing veterans at different service organizations. I have a very close relationship with the American Legion, VFW, Man of Honor, all the service organizations. And we do have a Veterans Service Commission that meets quarterly, made up of 4 members. And those funds are separate, and we use those for rental assistance and utility assistance, and we use those for various things. Again, I try to do referrals whenever possible, so Man of Honor might cover $1,000 for rentals, so that doesn't come out of my budget. VFW provides us gas cards, bus tokens, things like that, so it doesn't come out of my budget. So we work very closely with them, and we get all kinds of crazy questions all the time, every day. And then a lot of appointments. We do phone appointments and in-person appointments daily.
Any questions?
Can I just add one thing? So Jill referenced they are essentially a small but mighty department. I would be remiss if I didn't say, Jill's been with us for 4 years, and the change in terms of efficiency and process improvement has been immense over the last several years. Not only did we scanned all those materials, but they implemented a new claims processing process and put in place an electronic database. That team really does, as Jill referenced, they are exceedingly busy, but also very, very productive. They reduce the processing time that it takes to submit those claims on behalf of veterans. So really that department has done a great deal to enhance the lives of veterans. And we have seen, as Jill said, not only is it they've been busy, but the number of new benefit programs has increased as well. with the PACT Act and some of the other things that have happened. So Jill and her team have done very well. The highlight that I'll make, Krista already said that their 1-year anniversary of moving down to the Lakeview campus. Jill and her team are getting ready to move. We anticipate that that'll be done sometime in early 2025, and that her team will move down there. So we're excited about that because it's going to put veterans next to near social services, near the health department, but also near the other 2 departments that you're going to hear from here in a minute. So it'll really align well with the service delivery on the campus. And we'll start with Gary and with Vicki from North Central Healthcare, and they have a small part in our budget. I think I'll find the page, but as you'll hear from them, they do a great deal of work on behalf of the county, specifically Marathon County. But you'll hear from each of these 2 departments the next that are going to talk to you. There are mandated programs that Marathon County has decided to deliver in partnership with other counties for efficiency reasons, and really it allows us to do more in terms of service delivery. And North Central is a great example of that. It's a partnership with Lincoln, Langlade, and Marathon County to deliver on the county's mandate to provide community programs. So with that, Gary, take it away, and I will find the page in the budget.
Okay. Thank you, Lance. Yes, my name is Gary Olson. I'm the Executive Director for North Central Healthcare. I've been there for 2 years. Just over a year in this position. I started as their finance director when I was first hired there. I actually have 30 years of experience in county government. I know I don't look to be that old. I started at a very young age. No, just kidding. But I worked for Langlade County for 16 of those years. So that's where I became familiar with North Central Healthcare. And as Lance said, we are county government. We are the 3 counties community programs, behavioral health services, which Vicki will talk about. But before she talks about the programs that she's over, I wanted to talk about 2 programs that we also provide for Marathon County. One is the pool. We have the aquatic center there. It's a therapy pool. And if you have a doctor's referral, then you can attend that pool. It's very well utilized, and it's a very warm pool. It's 92 degrees, so it's a nice facility that we have there. We also run your nursing home, so we have a 120-bed facility nursing home. Just did all of the renovations that were completed last year, so we currently are not at, 160 beds. We are currently not at the 160 beds because of staffing. We're at more around 120 right now because we need CNAs. So we are currently doing everything that we can to find CNAs. If you know of anyone that's a CNA that wants a great job, we're a wonderful place to work. So we're in the process of filling more of those beds. And in our nursing home, we have rehab, long-term care, and dementia. We have a very good dementia care unit, one that's renowned in the state. Plus, we have a ventilator unit. There's only 8 vent units in the state, and we're one of them. We have 12 of the 160 beds are for the ventilator unit. So we have that. To give you an idea, the amount of individuals that we serve, last year we served just shy of 13,000 individuals. So when you look at Langlade County as a population, they're our smallest of the 3 counties. Of 19,500 is about their population. We almost served Langlade County. So we serve a lot of individuals. I'll turn it over to Vicki.
Okay, thank you. We were asked to keep it to 5 minutes, but I think we're going to start at 5 minutes now. So my name is Vicki Tilka, and I'm new to North Central Healthcare in senior leadership with the Behavioral Health Services, but I worked with Marathon County Social Services for many, many years prior to that, so familiar with the community and how all of our services connect. So Gary and I are part of a new team with our senior leadership team that really was created to better connect our services that we provide as North Central Healthcare with our social services department, because we are 3 of 10 counties that do not have human services combined. So we do the part of the human services requirements by the statute, and then Krista and her folks in Marathon County do the other part. So our part centers on mental health, substance use disorder, basically the behavioral health services for Marathon, Lincoln, and Langley. But we'll focus on what we do for Marathon because we do a couple of extra things for Marathon County in addition to what we do for the other counties. I did give you some brochures that will be really helpful for you to look through, that will give you more information than I can possibly say in these few minutes. But what I do want to tell you is North Central Healthcare is very unique statewide in terms of what we provide all in one campus area. And so we have a continuum of services that go from voluntary to involuntary with adults and youth in a variety of areas. So in general, when people start to work with us, if they are experiencing a mental health crisis, which is really defined quite liberally as something that is interfering with your ability to do things that you would normally do in your life or get things done that you need to get accomplished in your life, work, school, relationships, that type of thing, you can come to our crisis center, which is open 24/7 in person, as well as call. And so lots of people call through the phone line. They call multiple times. And also law enforcement then may bring somebody that they find that is in a mental health crisis. And that person at that point is going to be assessed, whether they're on the phone, whether they are in person. They're going to be assessed for any self-harm that they might be experiencing, as well as where they are with any substance use and just what is happening with them. And we're always going to be looking for trying to give them the best alternative for them, to wrap services around them to get them the help that they need, and maybe connecting them with other services that we have on our campus that I'll talk about. But it may be also just informal connections that they have, and they may just want to call us back to have a friendly voice, and we do that as well. So from crisis, if there is someone that is experiencing a situation where they need additional support, then they may be advised and voluntarily wish to go to our adult crisis stabilization facility, which is on campus, and stay there for a couple of days. It is a 24/7 program, voluntary, that adults can go to if they just need a break from things. There's treatment that occurs in there, and then there's connection to other services. Short-term stay, usually 3 to 5 days, and people can plan to go and do that in advance and not just when they're in crisis. Very similar to our youth crisis stabilization facility that we also have on campus for basically the same purpose. More of our youth have a planned intervention where they're expecting that, say, when school starts, it gets really tough for a kid. And so they may need to have some time away, and they may plan to come stay with us to take a break from their other, situation with their families, whatever dynamic they might be having. So we provide that services. Youth do have to agree to be part of that and be part of the youth crisis stabilization, to be there, I should say. And that, again, is 24/7. And they can also come during the day for some day treatment at times, depending on what our overall census is. So that really is the continuum we have around our crisis. If people need an inpatient psychiatric care, we have an adult and youth hospital on campus as well. And that basically means that you are at a level where a psychiatrist is going to be treating you. So definitely adjusting medication would be an example. It's an acute service. So meaning that it's not meant to be long-term. People can't live there. Once again, the average stay is about 4 days for people who avail themselves of those services. Our hospitals can be voluntary admissions, and they also can be involuntary admissions. And this is where the statute allows for and requires for law enforcement and counties to work together to identify when somebody is in a crisis that is at such an extreme level that they are determined to be in need of being detained on an emergency basis under Chapter 5115. So then for 72 hours of observation and evaluation to determine what's happening with them. And if the determination is that they need longer term care, then there would be a court hearing to determine that. So it's a very serious and very high level by the time people get to that point. But we do provide that as well. Now, going and looking at what we provide for substance use disorder treatment, we have a variety of things. We have our outpatient clinic, which does psychiatry as well as therapy, including substance use disorder. Most people we serve have mental health and substance use disorders both together, and so we're providing that outpatient support for them as well. We also have just reopened our 28-day residential treatment center, which is for people who are in recovery and, again, wanting to have extensive treatment where they can be away and can work through that healing process. That is voluntary as well. That is on campus, and that is our Lakeside Recovery. We also have sober living in Marathon County that is primarily for males, and then there is a home in Langley County that is primarily for females. And both places can take other residents within our 3 counties, so sometimes people change. They're not necessarily from the county that the home is in, but in general, the WASA home generally takes only WASA males. Then we have adult protective services as well that we do for all 3 counties, which is for adults who are either have a disability or who are elderly and have a situation, whether it's medical or cognitive, something that's getting in the way of them being able to safely make decisions for themselves. So we're doing evaluations when somebody is concerned in the community and saying, I feel like this person may be, either self-neglecting, abused, or financial exploitation is another major way that we would become involved with people and would connect with other services as well. Make that determination of what's happening, and then in some cases where it's determined that the person is unable to continue to make their own decisions, we would coordinate with the courts and doing a petition potentially for guardianship, and even in some cases protective placement where people will be placed in a safe environment. So just like Krista had shared about least restrictive, we're doing least restrictive in all the services that we provide as well. If people can get the help in the community, that's what we want to see in their own homes, and it's only when it reaches to the higher level where we may need to work with people on an involuntary basis, but that occurs as well. And then our other program that we have is community treatment, and this is one that has a variety of different programs that are authorized through the Department of Health Services for people primarily with mental health issues, but also some substance use that would receive case management in the community. And that's why we call it community treatment, because literally the people are living in their own homes, have their own places. Sometimes they're unhoused, and we're working with them and trying to stabilize everything in their life as well. But those people also could be availing themselves of other services that we have, like outpatient, our stabilization services as well. So again, they can be all connected at the same time for people. So I think I got all of our major programs in that. And it is very complex. So we have a very simple referral form. I always say to people, there can be one way to come in through a referral process, and then we're going to get you to the right program. Or again, if it's a crisis, then it's through our crisis program. All right.
All right. Next up will be Mike, but before we hear from Mike, I just want to, on North Central, within the budget, if you go to page 39 and 40 has a little bit of a summary of what they do, but also really importantly, there's a link to their budget because like Vicki said, there's a lot. Human services for counties that have a centralized single health and human services or human services department, that oftentimes is their largest department because there's a lot of mandates like Vicki alluded to. And when we talk about North Central Healthcare, Vicki and Gary used the word, it's unique. That's true. I would also say it's very, as Vicki alluded to, robust. We are one of only a handful of counties in the state of Wisconsin that have our own inpatient hospital. You'll often hear us talk about diversions or out-of-county placements. Similar on the youth side, where we talk about someone not being in their home. Well, when we talk about out-of-county placements for North Central, our inpatient hospital serves people locally. Other counties, they're always taking their people to Winnebago, Mendota, Clark County, or any of the other counties that have an inpatient hospital. We're really fortunate because it's a lot better to be able to treat people locally. So very, very unique, very robust continuum of care. And if you want to learn more, you can click on the budget. Within our budget, the county's budget, you can click on the North Central budget, and it'll elaborate on all the information that Vicki and Gary shared. So with that, we'll close it out with another multi-county organization, the Aging, Disability, Resource Center of Central Wisconsin, which is Lincoln, Langley, Marathon, and Wood County that have come together, similar to North Central, joined together to accomplish more, and that is on page 55. It begins in your budget book. Take it away, Mike.
All right, thank you for allowing me to come and talk today. I promise to, since I am the last one and you've had a lot of information thrown at you, that I will keep it brief and right to the point. So we are the ADRC of Central Wisconsin. We are formed by the 4 counties that we served as an organization to be able to provide both the Aging and Disability Resource Center services and the Older American Act aging services. So our organization really has 2 separate entities to it that are integrated into one to be able to serve the aging and disabled population seamlessly. So with that, we have a lot of different variety of services that we offer for our older adults. What I always say as a takeaway is that if there's ever a question or anything you want to know in regards to older adults or adults with disabilities 18 and older, we're your agency. So go give us a call. So there's your takeaway for today. But in regards to all the things that we offer, so we have what we call on our ADRC side resource services, which really can be anything. That could be starting with calling up just to ask about a resource or to have information about a resource, all the way to sitting down with individuals, talking to them about what their situation entails, how to keep them as independent and healthy within their own home, preferably, what that may look like, what supports and services they need to have built around them, what personal finances they may have, how to be able to utilize those personal finances the most effective and efficient way prior to getting to publicly funded programs. We are also the entry point into those publicly funded programs, so we do the eligibility determination for those publicly funded programs, which are Family Care and IRIS. So you may have heard the entities Inclusa or Lakeland Care. Those are the providers of that service type. So we're the entry point into those publicly funded programs as well, but work with all income levels, all individuals, to be able to make sure that they are able to understand what it may take and what resources are available for them, again, to stay independent and healthy within their home. So those are our resource services on that side. And in addition, we also have dementia care specialists working with individuals who may be newly diagnosed with dementia, or maybe they have a loved one who has dementia and they're wanting to understand what the progression of that is and what it looks like and how to maybe support that person best. We also work with businesses to help them understand the disease of dementia and how, as customers are coming in, how to interact with them most effectively and to work with them safely in making sure that they're comfortable in that situation. We have benefit specialist program, which is working with individuals with obviously Medicare, Medicaid. Medicare, if you haven't heard, is a pretty complex program, and it does have a lot of changes that occur on a frequent basis. So working with individuals to help them understand, as you're maybe newly coming into Medicare, you're 65 or going to be 65, going to be signing up for Medicare, what does that look like? We have a Medicare Basics class that people can take to really go through all those different Medicare A, Medicare B, Medicare D, talking about all those different entities and what they look like. But then also working with them if they're having issues with, maybe they've had a bill back to them or a provider saying that they're not covering that Medicare is not covering it, going through that appeal process. They do work with program attorneys, so they're able to have some attorney support as well to talk through that as well. So in addition, on our aging side, so now shifting to the other side of the organization, we have probably our most popular or well-known programs is our nutrition programs. So both senior dining and our Meals on Wheels program. So we do serve Meals on Wheels to every nook and cranny of all 4 counties. And if you know those 4 counties, you know they're pretty rural. So we get into all those different areas. And what I always say about Meals on Wheels is it's more than a meal. The meal is one component of it. But a lot of times those individuals, when they're getting that meal, that may be the only interaction they have with a human that day. That may be the only eyes on them to be able to make sure that they're safe and doing well. And they have some opportunity for a conversation. So the meal is obviously a important component for their nutritional needs, but just also that those other aspects of making sure that they're doing well and have some eyes on them as well. In addition, our senior dining, so we have a variety of different senior dining locations throughout our region where people can come to. If you're 60 and older, you can come to those senior dining sites and have a meal with other people. All of our meal programs are contribution based, so if you don't have the ability to pay for those, you don't have to pay for them. We do have a suggested contribution for each of those meals, which is a good portion of our budget as well. But if they don't have the ability to pay for them, they don't have to. That's part of that Older American Act programs as well. In addition, caregiver support coordination. A lot of times people don't sign up to become a caregiver. They become a caregiver based on circumstance or family situation. And what does it mean to be a caregiver and how to support that caregiver, how to make sure that they're taking care of themselves so that they can best take care of the person they're caring for. So we do have caregiver support coordination. We have evidence-based classes for, right now we've been focusing on falls prevention. If you don't know, the state of Wisconsin is #1 in falls-related injuries and death. And so we make sure that we are focusing on falls prevention. We've had collaboration with our fire departments. We teach an evidence-based class called Stepping On. It's really focused on preventing those falls and really making sure that we have that opportunity for people to stay, again, as independent and healthy as possible. The biggest thing in regards to our services is the population is aging, and through the year 2040, it's estimated that we're going to be continuing to increase that 60 and older population on an annual basis. The percentage of, especially our northern counties, which we're considered to be in, the percentage of the population that's going to be 60 and older will continue to increase each of those subsequent years. So making sure we have the resources around to support them, I think, is going to be essential. But the biggest thing is also to make sure that we're able to help them remain, again, as independent and healthy within their preferred living situation, because it's also cost effective. If you can keep them healthy and independent within their home, that means you're not spending either their dollars or public dollars on higher cost care. You heard from all of a lot of the human services. We all connect. We're all partners. It's not like we're in isolation or in silos. We connect across. A lot of times we have very similar customers and collaborate together. We are also a department that's moving back to the Lakeview campus, or the old North Central Healthcare campus, within the next year. Again, hoping for increased collaboration, just being down the hall versus a phone call. It can even help that collaboration grow even further. So, any questions?
All right, thank you. So that should be all of them.
Yeah, that's all the departments. The only other thing I would say is you also have, and I referenced it, within your budget, you will have the opportunity to hear from a number of nonprofits that are actually funded by Marathon County. This committee will probably most pointedly be interfacing with the United Way and with the North Central Community Action Program. I won't go into what they provide, but it's in the budget if you scroll to the section that talks about nonprofits. Those are two that the county board directs administration to contract with to provide services that support a lot of the services you heard about today.
All right, thank you. With that, we're going to be at 7C, brief overview of last term discussion and action. And I would encourage actually all the new members especially, and actually myself, to go back into the archives, past minutes, and look through what we've gone through in the last 2 years, I guess, or how far back you want to go. But that'd be very beneficial, as well as the strategic plan and the comprehensive plan, which will spell out our 3.3, 3.7, and 7.2, which we are either doing or in conjunction with public safety to familiarize yourself with what we actually do in this committee. So I would encourage you that. And with that, I will turn over 7C to Administrator Leonard.
Sure. Thank you, Chair Boots. That's a great segue. I think just real quickly on some of the things you talked about last term, I always like to talk about the things that you're going to hear that are operational. You heard a couple of them today, the budget amendments. So you had a couple of budget amendments that you've dealt with in the past through the health department with the lead in water and nicotine prevention and vaping prevention grants. You'll also potentially hear some new position requests. Your rules require you to have those go through standing committees. Krista referenced the children's long-term support positions that came through. Another thing you will likely see this term, which you saw last term, were some advocacy items. Gary referenced the nursing home. Last term, we had a number of discussions about how to advocate at the state level to ensure that there's adequate funding for government-run nursing homes and nursing homes in general. There was also a health care transparency bill that the committee moved forward to the county board. So those are some operational things. The budget, we'll have discussions at this committee about the mandated and discretionary programs that are delivered by each of the departments and organizations that you've heard from today. I referenced the nonprofits. And then Krista made reference to the Youth Opportunity Center. That was a big discussion. Family Keys, which started very early last term with Vicki making a number of presentations and Krista as well. You heard about the Community Health Improvement Plan. That you had a number of presentations last term about that from the health officer. You'd also have some presentations last term. I looked through the agendas that Chair Boots referenced. You got some presentations on programs of interest like the health department's work with Radon, the crisis assessment response team. And then you had a couple of what I'll say are large issues that spanned a number of departments, a number of standing committees, but this committee was very much involved in. A couple of examples: childcare, the shortage of childcare available, affordable childcare availability within the county. This committee actually was the lead committee in directing the county to apply for the Dream Up grant. So you had some discussions about that. The shortage of affordable or workforce housing has been a conversation at the full board level, and it also was a conversation here. Vicki made reference to the unhoused population. You had a very, I thought, very informative and productive conversation at the last meeting of the term about kind of some of the challenges within the community with the unhoused population. Chief Matt Barnes was here from the Wausau Police Department, and former Mayor Katie Rosenberg from the city of Wausau, talking about some of the challenges there, and that was a big area. And then also opioid funding. Just to ground everyone, and this was in the full board meeting last month, you are receiving opioid settlement dollars over a span of, I think, the next 15 years approximately. And the county board needs to decide how to allocate those funds. So you had a lot of discussion over the last term about how to do that. You got initial insight from the Criminal Justice Coordinating Council, and then it made its way through the board to really take the first step, and that is the gap analysis and the continuum of care for treatment and housing in the community. We should have those that information back in about the next 90 or 100 days. So those are all things you talked about last term, a number of which I think lead over into the next thing I'm sure the chair wants to have an interactive discussion about, and that is item D, the areas of committee focus over the next term. From the staff perspective, I anticipate those childcare, the housing discussion, the unhoused population discussion, and then the opioid discussion. I think all those things will probably continue. The question is, how do you want to integrate those, if at all, into your strategic plan discussions?
So with that, we'll move to 7D, and thanks for that, Administrator Leonard. I agree. The comprehensive plan is we're redoing this term. So with the comprehensive plan, we basically take out of the comprehensive plan the strategic plan. So the strategic plan kind of guides us where we go. So I foresee, obviously, with 333772 going forward with that, I will be looking to Supervisor Cavelli and Arstead, because there are veterans on here, to look at some of the things they'd like to see come forward. Housing's going to be a hot topic. Housing's been a hot topic at both WCA and NACO probably for the last 2 to 3 years. Opioid, obviously, fentanyl's the up-and-coming thing. Being the NACO delegate, one of the things I see for Health and Human Services, being on public safety and Health and Human Services, tend to go side to side, I guess. I see that usually you see the trends of the country. What's the next thing coming down the pipe that people are dealing with at counties, and housing's the one that I see. If I'm wrong with that, I mean, Administrator Leonard was there. That's kind of the direction they were going. Most of the counties are looking at housing alternatives, and that is all encompassing, whether it's childcare or placements or people coming out of jails. And I mean, it covers everything, homelessness, all of it. But yeah, I tend to, and I've done it on public safety, and I did it back when I was here, was focus on the strategic plan, because that's kind of our steer. It kind of tells us where to go. Now, with that being said, I encourage committee members, if they see something that they see being a Health and Human Services thing that we need to look at. I mean, the question I always say, is it a policy or an implementation? We're a policy board, so what's the policy we're going to bring forward to our staff to implement? So is it something we want to take on? And if so, what does that look like? Is it something we have to do statutorily? Is it something that would help another service be taking off of our docket if we contract out? Things like that. So that's what I'll be looking forward in this, to bring forward to the committee. With that, I guess I will open it up to anyone else on this committee to talk about the things they tend to, want to see happen this term.
Yeah, Randy, I really, one of the reasons I was interested in this committee, I just am very probably disturbed, like many others are, about the homelessness we have in our communities. There are jobs out there, and as far as we listen to all the services that are out there, seeing how maybe we can try to connect them to the people that do need it.
The last meeting, if you look at our minutes that was Chief Barnes came in, and former Mayor Katie Rosenberg came in talking about the homeless issue in Wausau and what the county's role would be in that, if any. So that is something we will bring forward. And again, that's a thing where we have to decide as a county board how much of a part of that we want to be. So those are going to be discussions we're having, and that's what we got to find as our niche of what we're going to do and what we plan to do. So thank you for that. Anything further for now? Like I said, I think it'd be good to go back, look at the last couple years of what's been done, just to see, and strategic plan, go through the 3337 and 72. I plan on having a couple more meetings, joint meetings with public safety with Chair Jacobson, and we used to try to do about 3 or 4 a year. Sort of been when Craig McEwen was chair of public safety. Go ahead.
Would it perhaps make sense to have a combined one with the Triple ED also, since economic development and the unhoused kind of go hand in hand?
So typically, yeah, if there's something that we see that we want to bring forward, if you bring something forward to myself or the vice chair and say, hey, this is something I see that we should maybe talk with, it always, in my mind, is better to get together beforehand and instead of just springing something on them that they need to be on. So yeah, if you have something like that, we'll always entertain those things, and then see what is our role as a county is what I always ask. The question what do you see our role being? That's a question I think we all need to ask every time we bring something forward. So yeah, absolutely, we've done things like that in the past. All right. With that, I do like to keep my meetings short, just so you guys all know. Hour and a half, I always feel after about an hour and a half, literally not much is getting accomplished in a meeting, and I'd rather do a second meeting than go over that hour and a half, 2-hour mark. But, so, go ahead, Ron.
Thank you, Mr. Chair. I'll make a motion to adjourn.
And a second. All in favor? Aye. Meeting's adjourned. Thank you, everyone.